Welcome to another episode from the Veterinary Research Channel. Today, we delve into a significant area of equine veterinary medicine, specifically concerning the health and performance of young thoroughbred racehorses. Our discussion will center on a recent study published in the Journal of Veterinary Internal Medicine in 2024, investigating the prevalence and severity of a condition known as exercise-induced pulmonary hemorrhage, or EIPH, in 2-year-old thoroughbreds. Furthermore, this research explores the potential link between this condition and racing performance, as well as the influence of factors such as pre-race medication, race distance, and track surface. Exercise-induced pulmonary hemorrhage is characterized by the presence of blood that can be detected through a tracheoendoscopic examination, a procedure involving a small camera inserted into the airway, or through a bronchoalveolar lavage, a method of collecting fluid from the lungs after a horse has undergone strenuous exercise. It is a condition that affects the majority of thoroughbreds at some point during their racing careers. Understanding its impact on performance is a critical issue within the horse racing industry. Previous research has suggested that an increase in the severity of EIPH is associated with poorer performance, indicated by a higher likelihood of finishing outside the top 3 positions in a race and lower race earnings. While it is known that the severity and prevalence of EIPH can be related to the total number of races a horse has started, there has been a lack of clarity regarding when thoroughbred racehorses first begin to experience this condition. For over 4 decades, a medication called furosemide has been employed to lessen the severity of EIPH in performance horses. When administered intravenously at a dose of 0.5 to 1.0 milligrams per kilogram of body weight, approximately 4 hours before intense exercise, it has been shown to effectively reduce the severity or occurrence of visible evidence of EIPH in many horses. Studies have indicated that around 68% of horses experience a decrease in the severity of EIPH following pre-race administration of this drug. However, the pre-race use of furosemide in North America has become a subject of increasing debate in recent years. Consequently, it has been prohibited in races for 2-year-olds and in certain high-level races for older horses at numerous racetracks across the United States since 2020 and 2021, respectively. Given these changes and the limited information specifically focused on 2-year-old thoroughbreds, this study aimed to determine the prevalence and severity of EIPH in this young age group in American racehorses. The researchers also sought to evaluate the relationship between EIPH and racing performance, as well as to assess the connection between the pre-race administration of furosemide and the severity of EIPH. To achieve these objectives, the researchers conducted a prospective blinded observational study. This involved 832-year-old thoroughbred racehorses competing at 15 different American racetracks between August 2020 and August 2021. These racetracks were geographically diverse, spanning from the east to the west coasts and from near the Canadian border to Southern California and South Florida. The regulations concerning the use of pharmaceutical agents before racing were determined by the individual state racing commissions and varied among some states. Following each race, tracheoendoscopy was performed on the horses between 30 and 60 minutes after the event, and a video recording was made of the examination. These recordings were then sent to 3 veterinarians with experience in evaluating EIPH. These observers were unaware of the identity of the horse, the trainer, or the racetrack. Each veterinarian independently assigned an EIPH severity grade, using a scale from 0 to 4 to each video. The prevalence and severity of EIPH were then determined based on these grades. The researchers also gathered race day records for each horse, including information on speed index, elapsed race time, track surface, race distance, prize money, furosemide administration, and finishing position. The study analyzed a total of 1,071 tracheoendoscopic examinations. Evidence of EIPH was observed in 66% of these recordings, and when looking at individual horses, the overall prevalence of EIPH was found to be 74%. Furthermore, 8% of the examinations revealed EIPH of grade 3 or higher, indicating more severe hemorrhage. Interestingly, horses with EIPH of grade 3 or greater showed a statistically significant lower speed index and a worse finishing place in their races. The study also found that the prevalence and severity of EIPH were lower at the 2 tracks where post-race tracheoendoscopy was mandatory compared to tracks where it was voluntary. At the mandatory endoscopy tracks, a negative association was observed between the probability of EIPH and the speed index, suggesting that faster horses were less likely to show evidence of EIPH. In contrast, at tracks where study participation was voluntary, the pre-race administration of furosemide was associated with a decreased probability of EIPH occurrence and severity. When examining the effect of the number of post-race examinations, the study revealed that repeated examinations of individual horses significantly increased the likelihood of identifying EIPH in that horse. In fact, over 90% of horses examined 3 to 5 times exhibited EIPH at least once. The number of race starts a horse had prior to examination, ranging from 1 to 9, was not found to be associated with the EIPH grade. The interval between consecutive races, ranging from less than 2 weeks to more than a month, did not have a significant effect on the EIPH grade. However, a relationship was found between race distance and EIPH grade, with horses racing over intermediate distances, 1,300 to 1,500 meters, tending to have higher EIPH grades compared to those racing over shorter or longer distances. The study also compared EIPH findings between horses racing in Maryland, where post-race tracheoendoscopy was mandatory and pre-race furosemide was prohibited, and horses racing elsewhere without pre-race furosemide and where endoscopy was not mandatory. The severity of EIPH was found to be lower at the 2 Maryland tracks compared to the other tracks. Specifically, no or mild EIPH, grade 0 or 1, was observed in 80% of the recordings from Maryland compared to 55% from the other tracks, while severe EIPH, grades 3 and 4, was seen in only 4% of the videos from Maryland versus 13% from the other tracks. Regarding performance, the speed index of the horses ranged from 1 to 104. A statistically significant negative association was found between speed index and EIPH grade, indicating that horses with higher EIPH grades tended to have lower speed indices. Furthermore, horses with EIPH grade 3 or higher were less likely to finish in one of the first 3 finishing positions compared to those with no evidence of EIPH. Interestingly, while horses with no EIPH accounted for 34% of all examinations, they won 43% of the races where the winner underwent tracheoendoscopy. Conversely, horses with EIPH grades 3 or higher represented 8% of all examinations, but only won 4% of these races. Pre-race intravenous administration of 250 milligrams of furosemide occurred before 127 of the 1071 post-race tracheoendoscopic examinations at 6 of the 15 tracks. While initial statistical analysis did not identify a significant overall effect of furosemide on EIPH prevalence and severity, this was attributed to the substantial difference in the number of horses treated with and without furosemide, leading to a lack of statistical power. However, analysis did indicate an association between furosemide use and lower speed index among treated horses. Horses treated with furosemide also had lower average earnings and competed in races with lower total prize money compared to those that did not receive the drug. In a small number of races where some horses received furosemide and others did not, no effect of furosemide on EIPH grade was detected, but this analysis was also limited by a small sample size. When considering racetrack factors, the geographic location of the racetracks was associated with the severity of EIPH, with some tracks showing higher EIPH grades than others. Track surface also played a role, with races on all-weather tracks being associated with lower EIPH grades compared to dirt and turf tracks. Multivariable logistic regression analysis further explored these relationships. When considering the prevalence of EIPH, the analysis indicated significant associations with speed index, furosemide administration, track surface, and whether post-race tracheoendoscopy was mandatory. Specifically, EIPH prevalence was lower at tracks with mandatory endoscopy. When the data was analyzed separately for tracks with voluntary versus mandatory endoscopy, different patterns emerged. At voluntary tracks, furosemide administration was significantly associated with a lower probability of EIPH. At mandatory tracks, where furosemide was prohibited, the probability of EIPH was lower on turf compared to dirt surfaces, and there was a negative association between speed index and the probability of observing EIPH. Regarding the severity of EIPH, grade 3 or higher versus lower grades, the multivariable analysis showed significant differences based on furosemide administration and whether tracheoendoscopy was mandatory. At voluntary tracks, the probability of severe EIPH was lower in horses receiving pre-race furosemide. However, at mandatory tracks, no significant association was found between EIPH severity and any of the model predictors. The findings of this study indicate that 2-year-old American thoroughbred racehorses experience exercise-induced pulmonary hemorrhage at a similar prevalence and level of severity as older horses. The approximately 8% prevalence of severe EIPH, grades 3 and higher, in this age group is consistent with that reported for the general racehorse population. This research corroborates earlier findings suggesting that the likelihood of EIPH in young horses is comparable to that of older thoroughbreds. While the prevalence of no EIPH in this study was slightly lower and mild to moderate EIPH slightly higher than in some larger studies of all-aged thoroughbreds, these differences might be attributable to variations in study populations and racing conditions. Interestingly, the current study, with a majority of examinations following races on dirt tracks, yielded seemingly different results regarding the association between track surface and EIPH compared to a previous study conducted entirely on turf tracks. When analyzed as a single factor, no significant difference in EIPH prevalence or severity was found between dirt and turf races, but EIPH was less common at the single track with an all-weather surface. This was supported by multi-variable analysis at tracks with voluntary enrollment and furosemide use. However, in Maryland, where endoscopy was mandatory and furosemide was banned, dirt races were associated with higher EIPH prevalence than turf races, the reasons for which remain unclear. The lower EIPH at the all-weather track should be interpreted cautiously, as horses at this track had slower average speeds, lower earnings, and most received furosemide, making it difficult to isolate the effect of the track surface alone. The high prevalence of EIPH in young racehorses is further supported by necropsy studies showing histological evidence of EIPH in untrained horses as young as 19 to 24 months. In this study, a significant 67% of horses examined after their very first race already showed endoscopic signs of EIPH, only slightly less than the overall prevalence. Furthermore, the likelihood of a horse testing positive for EIPH increased with the number of post-race examinations, aligning with findings from studies on older thoroughbreds and standardbreds, reinforcing the idea that EIPH is a common occurrence even in young racehorses. Concerns have been raised that the 2020 prohibition of pre-race furosemide in 2-year-olds might lead to more severe EIPH in this age group. However, the findings of this study suggest that 2-year-olds racing without furosemide did not experience EIPH more frequently or severely than has been observed in the general racehorse population. While furosemide has been shown to lessen EIPH severity in many horses, the current study had a limited number of furosemide-treated horses, making it difficult to definitively determine its effect on EIPH severity in this specific age group. Additionally, the lack of direct comparisons at the same racetracks between horses receiving and not receiving furosemide further complicates this analysis. Nevertheless, multivariable analysis, excluding one anomalous track, indicated that furosemide was associated with a lower probability of experiencing EIPH of any grade. However, the horses receiving furosemide in this study appear to be less capable athletes based on their lower speed indices, race purses, and earnings, making the apparent benefit of furosemide on EIPH probability potentially confounded and requiring further investigation. The unusual finding of increased EIPH probability with higher speed index at one particular track lacked a clear explanation. The racing rules in that state permitted the use of several drugs aimed at mitigating EIPH, and it is unknown whether any horses in the study received these in addition to furosemide, potentially contributing to this unexpected result. While the study lacked the power to definitively assess furosemide's impact on EIPH severity, it did suggest that, apart from the anomalous track, pre-race furosemide treatment decreased the overall likelihood of any grade of EIPH. The multivariable analysis confirmed that better-performing horses, as indicated by their speed index, were more likely to have no evidence of EIPH. Conversely, horses with lower speed indices had a higher prevalence of more severe EIPH. The finding that 2-year-olds with EIPH grade 3 or higher were less likely to finish in the top 3 positions aligns with previous research in older racehorses, suggesting that EIPH of this severity can indeed negatively impact performance. The observation that 2-year-olds racing at intermediate distances, 1,300 to 1,500 meters, exhibited more pronounced EIPH compared to those racing shorter or longer distances provides a novel insight. This finding contrasts somewhat with other studies that found varying relationships between race distance and EIPH severity in different age groups and racing locations, highlighting the complexity of this association and the need for further research specific to young thoroughbreds. The fact that 90% of 2-year-olds undergoing post-race tracheoendoscopy 3 or more times showed evidence of EIPH on at least one occasion reinforces the understanding that EIPH grade can vary between races in the same horse. While there is a potential bias due to trainers voluntarily enrolling some horses, the large proportion of repeatedly examined horses coming from Maryland's mandatory endoscopy program helps to mitigate this limitation. Overall, these repeated examinations support the widespread nature of EIPH in racehorses. The lower severity of EIPH observed in Maryland, where post-race endoscopy was mandatory and furosemide prohibited, compared to other tracks with voluntary participation and furosemide use, raises an important point. This suggests the possibility that previous prevalence and severity reports, often based on voluntary enrollment, might have been subject to unconscious bias, potentially overestimating the true extent of EIPH in the general racehorse population. However, the study acknowledges that other factors related to the young age of the horses and the specific conditions in Maryland could also contribute to these differences, emphasizing the need for broader studies in all-age thoroughbreds without voluntary enrollment bias. The unexpected finding that EIPH grade varied with racetrack location, despite no prior reports suggesting such a relationship, warrants further attention. While previous studies on EIPH risk factors have been more localized, this study's nationwide scope introduced considerable environmental variability. Investigating the potential association of these environmental factors with EIPH grade was beyond the scope of this study, but represents an important avenue for future research. In conclusion, this study provides valuable insights into exercise-induced pulmonary hemorrhage in 2-year-old American thoroughbred racehorses. It confirms that EIPH is prevalent and can be severe even in this young age group, impacting racing performance. Pre-race furosemide administration appears to lower the probability of EIPH occurrence, but its effect on severity in this age group requires further investigation. The association of EIPH with intermediate race distances and the variability observed across different racetracks highlight the complexity of this condition and the need for ongoing research to better understand and manage it. Thank you for listening to the Veterinary Research Channel. A link for the reference paper is in the video description. Remember to test your knowledge by answering the questions in the description, and as always, keep those minds inspired, hearts light, and tails wagging.